Now, there are many different types of headaches, therefore it's important to comprehend where they come from. They are all members of the headache family: tension, migraines, and the traditional sinusitis. However, there is a correlation between severe headaches and strokes that we shouldn't overlook. It's like your body is communicating with you in code if your head is pounding, and you also have a few other symptoms. By connecting these dots, we can take quick action and perhaps even lower the chance of a stroke. Let's therefore pay heed to these signals and maintain our good habits by doing so. Number 1. Limb weakness or numbness. Particularly when we're talking about strokes, feeling numb or experiencing weakness in your face, arms, or legs isn't just a momentary sensation. Let's examine the potential causes of these feelings. Pinched nerves, arthritis, and even carpal tunnel syndrome are among the common factors that lead to numbness or weakness. We need to comprehend the connection between numbness or weakness and strokes. Consider it as your body giving us signals that we shouldn't ignore. If you experience these emotions, especially if they pair up with other symptoms, it's a signal to act. Number 2. Difficulty in speaking. Struggling to talk after a stroke is not something to take lightly. It's like your body is trying to tell you something could be wrong with your brain. Finding the appropriate words is a challenge. Stuttering, slurring, and these are all signs of difficulty. It seems like your tongue and brain are attempting to communicate. Understanding the link between speech issues and the chance of having a stroke is crucial. Think of it as your body's method of sending us signals that we should pay attention to. It's a subtle push to act proactively if you run into such difficulties, especially if they coincide with other red flags. Number 3. Memory issues. The difficulty to recall details clearly is sometimes seen as just another aging indicator. On the surface, this could appear to be normal, but according to current study, memory loss can signal the beginning of a stroke. The significance of memory lapses as potential signs of various underlying health conditions has been explored in a recent study by Erasmus University Rotterdam. The results, which were reported in the journal Stroke, show a notable correlation between memory loss and an elevated risk of stroke, especially in people with higher levels of education. While prior studies have emphasized the likelihood of memory loss following a stroke, this study took a different approach by examining whether cognitive challenges could act as a warning sign before a stroke. According to the findings, people with greater levels of education who admitted to having memory problems had a 39% higher chance of having a stroke. Notably, this category included those with post-secondary degrees or comparable advanced occupational training. Number 4. Loss of balance. Loss of balance is a crucial marker of a probable stroke, mainly because it suggests that the brain's coordination center has been damaged. This brain-based coordination center is in charge of coordinating several sensory inputs and motor outputs to produce motions that are smooth and precise. A loss of equilibrium and balance may occur when this center is threatened. The inability to maintain balance is caused by a variety of conditions, including inner ear issues, muscle weakness, and drug adverse effects. It is closely related to one's sense of balance when inner ear issues, such as vestibular diseases, interfere with the signals delivered to the brain for spatial orientation and motion. The body's capacity to retain stability and react appropriately to changes in position is impacted by muscle weakness, which frequently results from a variety of underlying medical disorders. Additionally, some drugs may cause adverse reactions that undermine equilibrium. These side effects, which might raise the risk of falling and losing balance, may include dizziness, tiredness, or changes in blood pressure. It's crucial to remember that these factors might combine and increase the likelihood of imbalance rather than being mutually exclusive. Number 5. Vomiting and nausea. Because they are linked to a disruption in blood flow to the brain, nausea and vomiting can in fact signal the impending onset of a stroke. The bloodstream must deliver an ongoing, carefully regulated supply of nutrients and oxygen to the brain. Various neurological symptoms, such as nausea and vomiting, might develop when this blood flow is impaired, as is the situation with a stroke. Vomiting and nausea are brought on by the brain's reaction to the changed blood flow and its consequent effects on brain function. When the blood flow to the brain is impaired, the intricate regulation of internal processes, including the digestive system, can be upset. As the brain tries to regain homeostasis, This disruption may cause the body to experience reflexes that cause nausea and vomiting. It's crucial to take the underlying causes into account in the context of stroke, because a number of circumstances might lead to nausea and vomiting. Though they are not the only symptoms and can potentially result from other diseases, nausea and vomiting can in fact signal an imminent stroke. For instance, these symptoms may be brought on by food poisoning, which can irritate the stomach lining. Similar responses can result from viral infections when the body fights to rid itself of the invasive germs, particularly those that impact the gastrointestinal system. In addition to causing nausea and vomiting, motion sickness is brought on by signals from the inner ear and eyes that are in conflict. There is currently no scientific support for the hypothesis that there are precursory indications that appear months before a stroke occurs. However, there are many risk factors that can dramatically increase the likelihood that a stroke will occur. These include heart disease, high cholesterol, diabetes, high blood pressure, and use of tobacco products. To lessen the likelihood of having a stroke, these risk factors must be vigilantly managed together with the development of a health-conscious lifestyle. Additionally, prompt medical attention becomes crucial when symptoms like speech difficulty, sudden facial, arm or leg numbness or weakness, or a severe headache appear suddenly and intensely. These symptoms demand prompt medical attention since they may indicate the beginning of a stroke. We appreciate you watching the educational video we provided. If you find this information useful, please think about passing it along to your friends and family so they can get insightful knowledge on preventing strokes. Remember to like and subscribe to our channel if you want to be among the first to get informative videos on nutrition and health. We continue to wish you happiness, wealth, safety, and good health. If you have any questions, or if there's a topic you'd like us to cover in a future video, please leave a comment down below. And don't forget to subscribe to our channel and ring that notification bell so you never miss an update on important health information. Your health is important, and being informed can make all the difference. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Together we can spread awareness and potentially save lives. Remember, early detection and knowledge are your best allies in the fight against stroke. Stay healthy, stay informed, and take care of yourself. Until next time.